The threshold for entering stage 5 is somewhere between 70 and 123, depending upon the trajectory of that entrance into that red phase. So what we're doing today is meeting with our stakeholders, including the hospital systems, including the University of Texas and Dr. Lauren Myers and her modeling team, to look at the updated model based upon our current numbers so that we can determine if we need to transition to stage 5. We are desperately trying to avoid two things. Number one, the hospitals overcrowding and not being able to provide the same world-class care that they always do. And number two, we're desperately trying to avoid shutting down this economy through a recommendation to the governor to shelter in place. What we're seeing is that people are using caution when they're out in the public, when they're going to restaurants, when they're going to the grocery stores, but they feel more comfortable and are less protective when they're with family and friends. We cannot tell, and you cannot tell, if someone has COVID-19 and the ability to transmit that disease. We have seen the devastating effects of COVID-19 on families over and over and over again across this country. It's time that we listen to the message. It's time that we take action to protect ourselves and to protect our families and friends and the rest of the community. It's time that we also need to consider whether or not it's wise for us to attend religious services in person. I personally enjoy going to church in person, but as the rate of transmission increases, as we get closer and closer to overwhelming our healthcare system, we have to act in a more protective way. And that means if you have the option of tuning in from home to those church services, my advice would be to do that now and to take other protective actions so that we can slow the spread, we can avoid overwhelming our hospital system, and we can avoid having to make the recommendation to the governor to go back to a shelter in place.